Will Boyd was at the funeral Saturday morning for a relative who had died after contracting the new coronavirus when he got the call with the news. His brother had also passed away from COVID-19. The virus is real. It's real. If they don't know it's real, they can come and walk with me to the cemetery, Boyd said of the skeptics. Alabama and much of the Deep South are seeing a spike in coronavirus cases as some have stopped heeding warnings of the virus, alarming public health officials and people who have lost loved ones because of COVID-19. Over the past 2 weeks, Alabama had the second highest number of new cases per capita in the nation. South Carolina was fourth. Louisiana and Mississippi were also in the top 10. We are extremely concerned about these numbers. We know if they continue, we will see more hospitalizations and more deaths, Alabama State Health Officer Scott Harris said. As of Saturday, Alabama had more than 29,000 confirmed cases of COVID-19, with more than a quarter of the cases reported in the last 2 weeks. The combination of pre-existing health conditions and limited healthcare access in the region, along with pockets of public skepticism about health officials' advice on the illness, complicate attempts to manage the virus. Dr. Selwyn Vickers, dean of the UAB School of Medicine, said the South has high rates of diabetes, kidney disease, heart disease and high blood pressure, all illnesses that put people at risk for poorer outcomes with COVID-19. But Vickers said human behavior is the most difficult aspect of fighting the disease. When you open the doors and you look at the beaches, you look at the restaurants and you look at cities that choose not to do masks, or individuals who don't. I would say our behaviors create the biggest challenge for us, Vickers said. Vickers said people who won't wear a mask for their own protection should think about worrying about infecting someone else. State Representative Marica Coleman wants people to heed the warnings. Her extended family had come to Alabama from across the country for a funeral in March, a time when the state had few coronavirus cases, and used the time together to reminisce, laugh and weep. In the weeks and months that followed, 11 family members tested positive for COVID-19 and 5, including 3 who had been at the gatherings, died from the illness. Our family won't be the same. I don't want it to be anybody else. I don't want anybody else to feel the way I feel. I don't want anybody else to go through what my family has gone through, Coleman said. Coleman said she could not believe the large crowds she saw on Memorial Day from social media images from the beach, and even in her own neighborhood. What is bothering me right now is people are operating like COVID has been cancelled, like it's not there anymore, she said. Kira Porter, who lost 3 members of her East Alabama family to COVID-19, has the same fears.